time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, who is the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and David.
Well, Doc, the FDA, we all know they approve drugs for the folks here in the country, but nearly 1 in 3 newly approved drugs later has a safety concern. What does that mean for us?
Well, David, I don't mean to alarm listeners. These safety concerns are usually minor, and they infrequently occur, and usually they're not serious enough to require withdrawal or recall of that drug from the market.
What is it the Food and Drug Administration does that kind of misses the part that might be a little dangerous?
Chris, the FDA in approving drugs relies on clinical trials, and usually these trials don't involve that many people for that long of a time. And so when the drugs are ultimately approved, a lot more people try them over a longer period of time, and in that more intensive use, it's discovered that there may be additional side effects that weren't first detected.
Dr. Hiatt, the NBA playoffs have been on lately, and of course the Cleveland Cavaliers are doing very well. And their star player, LeBron James, we have found out recently he uses a hyperbaric chamber between games. Tell us about that.
Well, what LeBron does is he gets into this giant chamber that looks like a giant duffel bag. And he stays there for about 90 minutes at a time. And the reason that LeBron does this is that he feels that it keeps his body in peak condition.
All right, Doctor, I know that back in the day we heard Michael Jackson use them, and now we hear about LeBron using them. Is there any basis in science for this, or is this just a fad that psychosomatic and they think it helps them?
You know, David, athletes have been using these chambers, and they really claim that they work. What they do is these chambers create more blood flow. And so athletes are able to recover more quickly, is the thinking. Hyperbaric oxygen therapy is also an investigational medical treatment that reportedly enhances, our body's ability to heal itself, because with more oxygen, it's able to clear more waste and have more blood flow to the tissues.
What kinds of conditions are usually treated with a hyperbaric chamber?
Well, hyperbaric chambers have been used and are used to treat just a wide variety of conditions, including stroke, head injuries, infections, and chronic fatigue.
All right, Doc, I'm a weekend runner, and I read this past weekend where a marathon runner almost broke the 2-hour mark. What's all this news about Nike's Breaking 2 project that I hear about?
Well, as runners know, it's really hard to run a marathon in under 2 hours. Just only the elite among us can do it, and to date, no human has done it. But last Saturday in Italy, a Kenyan runner, who is the current Olympic champion, actually ran the marathon in 2 hours and 24 seconds. He missed the 2-hour mark by 24 seconds, but this is an amazing feat because he smashed the current world record of 2 hours and nearly 3 minutes set back in 2014.
Well, do you believe the 2-hour mark will ever be broken?
Chris, that will be an amazing thing to ever see, because you'd have to run a pace of 4 minutes and 34 seconds per mile and sustain that for the full 26.2 miles. I think it can be done. 63 years ago, back in 1954, Roger Bannister broke the 4-minute barrier for running the mile. And at that time, it was thought that it could never be done, and yet he did it. It's interesting, in that same year, about 20 other runners broke that apparently psychological barrier.
Turns out it wasn't a physical barrier after all.
And the same may pertain to the 2-hour mark for the marathon.
Dr. Hiatt, thank you for your time today. We certainly appreciate the information.
Thank you.
It's the KBOI Medical Moment every Tuesday, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence.